Hi, I'm Dr. Wood from the Wetlands and Wildlife Care Center, and I'd like to talk to you today about the domoic acid crisis that's affecting the wildlife up and down the coastline of Southern California. Here at the Wetlands and Wildlife Care Center, the vast majority of the patients that we've been getting into care are brown pelicans. So the patients that come into care experiencing symptoms associated with ingestion of domoic acid can experience a range of symptoms, ranging from mild signs of disorientation or the body swaying to more severe signs of really bobbing the head and swaying in a figure-8 motion, being extremely disoriented, to the most severe, which are in a seizure state. And those are the ones that are the most difficult to try to save, unfortunately. So when they come into care, our initial efforts are aimed at stabilization. So we give them heat support, we place IV catheters, we give them fluid therapy with B vitamin, and then we start to treat their abnormal neurologic symptoms. So we layer various anti-seizure medications until we get that seizure activity under control, which can take typically days. So some recover and start to show improvement within hours, but many take days before they start to show improvement. So it's a combination of supportive care, anti-seizure medications, and then the third part is nutritional feedings, because many of these patients can't eat on their own. They're very disoriented, they're neurologically abnormal, and so we assist feed or tube feed them and until they can eat fish on their own. And that's a marker that things are starting to improve. So once we get them through the most critical period of medical care, then they continue getting supportive care like heat support and are housed indoors until they are thriving, gaining weight, eating on their own, and their blood work improves. And then they come into our outdoor enclosures where they're able to swim, preen, fly, and forage for fish on their own. And so we have quite a few that are survivors and are ready to go back into the wild. We just don't have a safe ocean to put them back into just yet. So we're working on a plan for potentially transporting them further north where hopefully this crisis is not affecting the local wildlife like it is here. Unfortunately, not every animal that comes into care survives. So right now we have about a 35% success rate, and that depends both on the severity of symptoms and how soon they come into care. But our staff is incredibly dedicated, putting in an incredible amount of labor-intensive hours to try to save every single one that comes into care. And we are really happy that we have had as many successes as we've had, and we hope to see our friends fly free soon.